Hi, Commissioner. It's so good to see you. I know you're just getting out of self-quarantine. How are you?
Oh, I'm fine. I was exposed, but luckily, no symptoms and tested negative.
Great. Okay, so the second wave, can you tell us just how serious is it? And does it only end with a vaccine?
Well, that's really interesting because everybody wishes it would end with a vaccine. You know, a vaccine's going to take a while to take effect. You get, particularly with the first two vaccines, Pfizer and Moderna, both of them require 2 doses, and you need to build up immunity after your doses. The most important thing is all the prevention strategies, masking, socially distancing, avoiding large gatherings, even masking in your house if someone from your bubble is in the house. The surge is serious. We're seeing the same increase in cases that we saw back in March, but the trajectory, the steep incline is not as steep. So it's creeping up more slowly.
Okay.
So our predictive modeling shows that if we do nothing, if people don't pay attention to the prevention safeguarding mechanisms, we could be right back into April, similar to April, mid-January.
Wow. Okay. And I know one of the big concerns is that that causes a strain on the healthcare system. What exactly does that mean?
Well, we run out of beds, we run out of equipment, we run out of personal protective equipment, and we run out of staff. So we have controlled for most of that. We learned from the first surge. We have a stockpile, a strategic stockpile in New Jersey for personal protective equipment. We have a stockpile for ventilators. We have a mechanism to allow the hospitals to increase their critical care capacity. And since March, we know every day, every bed that is filled in our hospital, medical, surgical, and critical care. And we know that if it reaches a level where we don't have like 10% of our critical care beds available, we have to put in some restrictions or curtailments. We're not there yet. What we can't control for is staffing.
Yeah.
Staffing will be a problem. Last time we were able to pull from other states. Every state in the nation is in the same situation. So we work with our hospitals on staffing plans, moving from conventional staffing to contingency staffing to crisis staffing. I think what we missed in the last surge that we will not miss this time is to really educate the public to what that means.
Yeah. Yeah. It's amazing. I didn't realize. So you're saying that in the spring, staffing, you had to pull staff from other states.
We actually had a whole corps of nurses that came in from Denver,
Wow.
Colorado, definitely Pennsylvania, all of the states that did not get hit like New York and New Jersey.
Wow.
So nurses were coming in. We were waiving, we were developing reciprocity rules, waiving a lot of the restrictions.
Yeah.
We did that for nurses and for nurse aides.
Okay. So the vaccine, what role will the health department play in distributing it?
Well, we have been planning for this vaccine rollout since about April.
Okay.
We have a team here that is the vaccine team. There are 9 task forces working on the logistics, the distribution, the public awareness campaign, management, administration, and budgeting. So we will have, with our local partners, and there's lots of them, hospitals, FQHCs, long-term care facilities, chain pharmacies, local health departments, our LINKS emergency units, and our counties. We will be bringing up hundreds of vaccine sites in New Jersey. Okay. Anybody who wants a vaccine, when we have enough supply, which we hope will occur the end of March, will be able to have a site close to their home to be able to be vaccinated.
When you say enough supply by the end of March, what does that mean for everyone?
Yes, initially, we will have limited supply. We will get doses to our hospitals to be able to vaccinate healthcare workers, paid and unpaid, that are at the high risk of coming in contact with infectious materials. Then we will move to long-term care, our residents and the workers who take care of them. And then as we get more and more doses, we'll move to essential workers.
Okay. Okay. So here's something that concerns me. If there's 2 doses, if you miss that second dose within that window, you've wasted, am I right? A dose that is really needed. So how do you make sure that that doesn't happen?
Well, that's a great question, and that's probably the biggest dilemma that we have. So everybody that comes to get vaccinated will be enrolled in our immunization system. We will know when they have to come back. They will get a postcard. They will fill it out. That postcard will be sent to them when they need to come back. Now, we know historically 30% of individuals never follow up. We know that in hospitals, in our clinics. We know it in our FQHCs. We know it from other vaccines like shingles that require 2 doses. That's a problem.
Yeah.
So we are trying, we're having, we'll have callback systems. We'll have postcards. We will have COVID-19 vaccine ambassadors in our cities that will go out door to door and remind people. We will do whatever we can to get 70% of our adult population immunized in a 6-month period.
Okay.
That's 67 to 87,000 doses a day.
You say 70%. Why not 100? Is that just not possible?
Well, with the vaccine is now not available for children. It has not been tested on children under the age of 16, and it is not available for pregnant women. So we have to take them out of the mix.
Right.
And 70%, historically, for flu vaccine, we vaccinate 50% of the population in New Jersey. But within that 50%, 70% are children. So we don't have a great high vaccination rate.
Wow.
But we are definitely focusing on 70%. We want to get to a level that presents us with community protection, or herd immunity is the term others use. We talk about community protection. And in order to do that, we need to get those numbers up.
Okay. All right. So as part of the Women's Empowerment Series, I spoke with Laurie Herndon and Amy Mansu, and they talked about you and how in the springtime, the health department was so helpful. And they said, and most people don't realize that the health department is run by a woman and a nurse. Is there something that the health department did that you think most people don't realize?
Well, we managed the whole surge from this conference room. This was our war room. And within 3 weeks, we worked with the Army Corps, we put up field medical stations. Within 4 weeks, we commandeered empty hotels and put up isolation and quarantine spaces for individuals who could not safely isolate or quarantine at home. We put together the wraparound services, all the social services that are required to support individuals during a time of total crisis. When I go back to March, April, the people on the front lines and what they had to deal with was just overwhelming. We also had an unspoken rule, no matter who called us from outside that were trying to help our communities, we called back. And if whatever they needed, they got a call back within 24 hours.
Wow.
And we literally, from March 4th, our first case, to Memorial Day, this team here worked 7 days a week in this conference room.
Sure.
And our goal was to try to prevent as much as we could and to help it and support as much as we could. And it was a true crisis.
Yeah. Was there a specific moment when you realized how bad it was?
When I got a call in the middle of the night from Colonel Pat Callahan from the state police that There was a hospital in North Jersey that had run out of ventilators, and we had to move ventilators in the middle of the night. And could I look at where the ventilators were and who could give up a ventilator? Who do we have to call? So, we had separated the state into 3 regions because we thought it would be easier to move equipment and patients around within a region. So we used the level, we engaged the collaborators from the level 1 trauma centers. That worked out. That was an excellent way to look at the state. We'd never looked at the state that way before because we're kind of a condensed state. We always look at the state. So we separated it out, and we had Kevin O'Dowd in the south from Cooper. We had John Gantner centrally from Robert Wood Johnson, New Brunswick. And we had Sharif El-Nahal from University Hospital in the north. We were on calls with them constantly. So in the middle of the night, I got that call. I said, we're running out of ventilators.
Yeah.
We have a real problem here.
Yeah.
We have a real problem.
Yeah. So how your nurse as a background, how has that affected your work now?
Well, candidly, it's not only my work as a nurse, but also in hospital systems. The surge hit the hospital system, so I know how they work. I know how they think, I know how they work. But my nursing background, everybody forgets that our education is rooted in science. We are educated. We have to take the microbiology, inorganic, organic, and biochemistry, anatomy and physiology. And in a lot of colleges, you take that with the pre-med students. It's an arduous education. That has helped me more than anything. I've been in community health, public health. I've been out on the streets in Newark, New Jersey as a community health nurse through my education. And once you kind of get that picture, you know how to operationalize in a crisis. It's different than conceptualizing on paper. You have to do that first.
Yeah.
But nurses know how to operationalize. They know how to move the science to the bedside, the science to the community, the science to the person. And that makes all the difference. And that has helped me immensely.
That's fantastic. So last question, what do you think the future looks like? Will we always be wearing masks at some point during a year?
We will be wearing masks, safeguarding, socially distancing, staying home if you're sick, working home as much as you can for the next year.
Yeah.
By the time we immunize 70% of the adult population in New Jersey in 6 months, and everybody builds up immunity, and you remember, these are new, some of these are new vaccines, never used before.
Yeah.
And so we'll be learning as we're, like the governor likes to say, we're building the plane as we're flying it.
Right.
We'll be learning, and at the same time protecting ourselves.
Yeah.
So I expect 2021, maybe towards the summer. We know that this virus doesn't like warm weather. That's a good thing.
Yeah.
Towards the summer, going into the fall, if enough people stand up to be vaccinated, we continue prevention. This mask is the most important thing that I put on every day. And I never take it off.
So what do you say to people who don't put it on?
I say, help yourselves. It's protecting yourself and your loved ones. Right now, our biggest increase in cases are in younger individuals, 18 to 40. Our largest number of deaths are in those that are in their 70s and 80s. So younger people must be infecting and transmitting this virus to older individuals, their aunts, their uncles, their grandparents, maybe their own parents, and those individuals are dying. Wake up and wear your mask. Socially distant, wash your hands, do the whole thing. It's not that difficult.
Yeah, that's great. Thank you so much for all the work that you're doing. And thanks for talking with me.
Oh, thank you so much for inviting me to the talk. I really enjoyed it.
Certainly.